Miami beaches closed for the big 4th of July weekend. That obviously put a damper on a lot of holiday plans, vacationer plans. But at the very least, it is changing the way people think about the progress or the resurgence of these virus cases, which are now running about 13% positive in the entire state of Florida. Greg Steube joins us right now, the Florida Republican congressman, also serves House Judiciary Committee. Sir, very good to have you. What do you make of this and this spike in cases in your state? You know, this happens when we obviously get more testing, but the streak of positive cases is alarming some in the medical community. What do you think?
Yeah, I mean, the first thing is there's 200,000 tests a week that we're doing in Florida. So obviously you're going to see a spike in the number of positive cases. And the vice president had it right. You're seeing asymptomatic individuals between 18 and 35 who are testing positive. They don't have symptoms. And so that's a good thing. We don't have an elderly population. You don't have people in nursing homes because of the things that Governor DeSantis has put in place to ensure that our elderly population is protected, unlike the type of things that you've seen in New York. And if you compare overall cases in Florida to states like New York, we still only have 3,300 deaths compared to 31,000 deaths in New York. That's almost 10 times the amount of deaths. So the amount of cases is obviously an indication of the amount of testing that we're doing. If you drill down on the numbers of hospitalizations and those patients seeing ICU beds, that number has stayed flat. I get numbers in my district every day from each of the 9 counties I represent, and those hospitalization numbers are about the same as they've been a month ago. So I'm not too alarmed because we have so much testing going on in the state of Florida, and we can't keep our economy shut down forever. So I think a gradual reopening is a good thing and get our economy back to work.
Congressman, do you think that Floridians were just ignoring some of the distancing provisions and rules on capacity at restaurants to the point that they did this to themselves, that now they might be doing it so often that it's going to compel the governor to order such restrictions, to order the wearing of face masks, that sort of thing?
Well, we just had all of these protests, and you've seen them across the country. We had them here in the state of Florida, where young people between that 18 and 35-year-old age demographic are down in huge groups without face masks on, protesting different things that are going on. So I certainly think there's some correlation there. I've seen videos in Tampa of a Walmart being looted where all of the people running in didn't have face masks on, all congregated together. So most Floridians are being smart and safe about this. If they're in the high risk category, wear a face mask when you go out, socially distance. Don't even go out. I talked to a gentleman in my district yesterday that said that he's high risk and he's just not going out. And if he does, for some reason, he wears a face mask. So I think the numbers you're seeing are because of the increase in testing. The demographic that you're seeing in the increased amount is a demographic that's not at high risk to see hospitalization. So I think we're in a good place here in Florida right now.
You know, northeastern states are now not too keen on Florida residents coming up to their states, among other states, Arizona, Texas. What do you think of that?
Well, I certainly disagree with shutting that type of thing down, because if you look at the percentage of the amount of people, again, that are testing, like I read something from Governor Cuomo that said that they had such a low amount of those testing positive. Well, I can guarantee you they're not doing 200,000 tests a week in the state of New York. And so obviously their numbers are going to be different. Again, people can be safe. They have personal responsibility and individual liberties to make up those decisions to ensure that they're not infecting other people. If they're sick, stay home. If you're out and about, do the things that the CDC is recommending to do.
Congressman, we'll watch it very closely. Thank you for joining us on a Saturday to discuss this. We'll be watching it closely, as I'm sure you will. Congressman, be well, be safe, and be healthy.